This is ACEP's Capital Minute, a look at what's happening in Washington, D.C. right now affecting emergency physicians and your patients. I'm Laura Wooster. After a 2-week recess, Congress is back in session. Congress has started the process of putting together a new package of bills to address the opioid epidemic. This legislation is intended to further build upon the 2016 Comprehensive Addiction and Recovery Act, or CARA. Potentially being included in the opioid package are 2 bills specific to emergency medicine that ACEP was instrumental in developing: the Alternatives to Opioids in the Emergency Department Act, or ALTO, and the Preventing Overdoses While in Emergency Rooms Act. Shortly before the recess, ACEP board member Dr. Mark Rosenberg testified before the House Energy and Commerce Health Subcommittee to urge lawmakers to support these bills.
It took many years to get to this crisis point, and unfortunately, it will take some time to resolve the epidemic. But we are on the right track. Provide us with ALTO and MAT tools and funding, and emergency physicians will be able to provide a better future for our patients as well as society.
Dr. Rosenberg's testimony was part of a 2-day hearing that also included FDA Commissioner Scott Gottlieb and Dr. Ann Shukot, Principal Deputy Director of the CDC. Last week, the Medicare Payment Advisory Commission, or MEDPAC, voted to approve 2 recommendations it developed on freestanding EDs. The first calls on Congress to reduce Medicare facility payments by 30% for hospital-affiliated freestanding emergency departments that are within 6 miles of an on-campus hospital emergency department. The second recommendation calls on Congress to allow rural hospital-affiliated freestanding emergency departments that are more than 35 miles away from another ED to bill standard outpatient prospective payment system facility fees and also provide them with annual payments to assist with fixed costs. MEDPAC's recommendations to Congress are only just that, and Congress can choose to either follow them via legislation or ignore them altogether, as has been the case more recently. ACEP believes that all freestanding EDs, whether hospital-affiliated or independent, that adhere to certain standards should be reimbursed by Medicare, Medicaid, and third-party payers. Last month, ACEP submitted comments on the Department of Health and Human Services' proposed rule around enforcing conscience protections for providers. ACEP strongly objected to this proposed rule and does not believe it should be finalized. As written, it did not reflect nor allow for emergency physicians' moral and legal duty to treat everyone who comes into the emergency department. ACEP believes denial of emergency care or delay in providing emergency services to anyone of any background is unethical. This week, CMS finalized new policies for the ACA exchanges that create more flexibility for states to select their benchmark plan, which defines the standard set of benefits that must be covered by ACA plans in that state. There are currently 10 essential health benefits that plans must cover, including emergency services. Allowing states to change this could not only impact how emergency care is covered, but how other services are covered as well, leading to patients delaying care and then eventually being forced to make a trip to the emergency department. ACEP's Leadership and Advocacy Conference from May 20th to the 23rd will celebrate emergency medicine's accomplishments. Attendees will advocate for improvements in the practice environment for our specialty and access for our patients. First-timers will receive special training on how to meet and educate your members of Congress and their staff, while seasoned participants will build upon valuable congressional connections. HHS Assistant Secretary for Preparedness and Response, Dr. Robert Kadlec, who will be presenting during the Public Policy Town Hall on emergency preparedness. Dr. David Rear from George Mason University will address how to effectively communicate with legislators and staff. Amy Walter, National Editor for the Cook Political Report and TV commentator, will offer her predictions for the midterm elections. Senator and Dr. Bill Cassidy of Louisiana and Representative Kirsten Sinema of Arizona will also participate.
An MEDPAC VIP reception will be held on Sunday, May 20th at the International Spy Museum. Additionally, we ask that you join your emergency medicine colleagues and some of the nation's most influential lawmakers during fundraising gatherings. So far, we have events scheduled with Senator Debbie Stabenow and Representatives Greg Walden, Carlos Curbelo, Raul Ruiz, Ami Berra, Kirsten Sinema, Dutch Rupersberger, and Bill Pascrell. If you are interested in participating, please email Jeannie Slade at the link at the bottom.
That's ACEP's Capital Minute for the second week of April 2018. I'm Laura Wooster. Thanks for joining me.